So, from your perspective, what were the signs that led you to believe that something was different or off from me? I mean, besides, I was working nights back then, and but what were the signs that told you this is different than just stress or work related?
Well, for sure, that one time you've always been so sexual, and I initiated,
Hmm.
and it was the first time you ever declined. So I was like, "What? Are
I
you
think I do
cheating?"
remember that
I'm
time.
like, "Are you cheating?" You're like, "I'm just so tired. I'm so exhausted." Um, and the bag under your eyes, you just look physically drained.
Yeah.
You look like you're in some type of weight loss medication.
Like I had Ozempic face.
Yeah, Ozempic. You had the Ozempic phase and the circles under your eyes. That's when I really noticed.
And so let me ask you something. I mean, since I met you, social life and being active and going out was very important for you. How did you feel that being affected by what was it going through?
Well, you never had energy to go out to do anything. You've always been a little more introverted. So I knew that you didn't always want to be out and about,
Hmm.
but you were just always tired.
So just okay. Um, and was that like different from like when you met me?
Yeah,
I
for
mean, we
sure.
known each other since like we started dating in 2018, and I think this difference or this decline was what, like 2022, 2023 maybe.
I don't remember, but we always wanted to do a Sunday fun day or a nice brunch or definitely a night out, like date night once a week. And you didn't even have the energy to do that. Like you wanted to spend time with me,
Hmm.
but it was more like couch potato type of like popcorn and ice cream, which is fine. And I like that as well, instead of just getting dressed and going out to a nice place.
And how did that make you feel as my partner?
I mean, I wanted to feel empathetic and understanding of what you were going through because obviously I knew you were working nights. We had a newborn baby, so I just thought it was natural to feel that for you to feel that way, and I also didn't want to make you feel guilty. Um, but at the same time, I'm like, this is not what a young couple should look like.
Hmm.
Like, I don't want to become one of those boring couples that they just become couch potatoes and
Hmm.
big underwear and flowy PJs every weekend, which is fine and comfortable, but I didn't want to fall into that category.
Yeah, yeah, I think that was that was a shift definitely from what we lived through when we met and started dating, and we lived in Morristown, and then we moved to Miami, and we lived 2 years there, and I think it was a lot of fun. And then when we came back and I started working nights, that's when things shifted a little bit, I think.
Things didn't shift a little, things made it 180. You were tired, you were just exhausted.
Yeah, yeah. So when I started on TRT, I think like I said, I think it was somewhere between like 20, maybe it was 2023. I think it was right after our second child. Um, and that conversation never happened between both of us. Like there was never a sit down where I asked you or I told you, listen, babe, I'm gonna start this treatment. This is what's going on with me. I think I just went through all the steps by myself for whatever reason.
I think you briefly did mention it. I'm not into medicine, so
Yeah,
I don't understand it. So you just, yeah, I mean, you did it, and you started with a nurse practitioner.
yeah, yeah. I was like with this online TRT clinic and nurse practitioner. I think I did mention it to you.
Yeah,
I'm seeing this nurse practitioner and I'm looking into my testosterone levels. And I think it's an issue.
yeah.
Um, but it was never like a big sit down, right? Because nowadays, for example, when I prescribe TRT, a lot of the times I ask my patients, have you had this discussion with your wife? Because there's there's a lot of side effects, right, or connotations to it, um, that I think it's important to discuss as a couple, right? So since we never had that discussion, looking back,
So we're having that discussion now.
I mean, I think we've had that discussion already. But like looking back, what kind of questions or concerns would you have regarding your spouse starting TRT?
Well, first of all, I would want to know what are the effects,
Mm-hmm.
right? Is this something that you're going to have to do for the rest of your life? How much does it cost? I think the average questions that most people would have,
Yeah.
but mainly what are the side effects?
Right. Okay. Were there any like fears or concerns? I mean, besides like the usual questions of like side effects and cost, which are sort of like the practical things. At any given point, did you have any like fears about it? Like for example, a lot of people have this general idea, which sometimes is misguided, regarding like mood swings or like roid rage, right? Did you ever have like those concerns? Maybe not. I don't know.
No, because I don't didn't know much about it,
Okay. All right.
and you didn't really mention it, so I didn't have any questions.
Fair. All right. Good. Okay. One last question about this part. In your eyes, as a woman, as a woman who have you've lived a lot, you've traveled the world, you've had a lot of fun. Then you met me. We've formed a beautiful family. What would you say is the main barrier of men above age 35 or 40 that are just tired or chronically fatigued or going through like similar situation as I was? Um, what what do you think would be the main barrier of them starting a treatment like this? As a woman, like what do you
The
think?
main barrier, I don't understand. I'm not sure. What do you mean?
Like I think there's a lot of men out there that go through the same thing. Um,
Correct, but what do you mean by the barrier for a man to start that process?
let's say
Like
is
the
it
concerns
no,
or
I mean, it could be concerns, could be like ignorance about the subject, could be maybe fear from, maybe the spouse thinking like, oh, my
well, I think
partner.
you just said it. I think it's just ignorance is bliss.
Hmm.
So for me, it was kind of like ignorance. I didn't know that you could go on this treatment and do a 180 and look and act and behave and feel the way that you feel now. So
Hmm.
I think men just lack that information and
Yeah.
the proper resources because there's so much misinformation out there. So just lacking the right information and having a difficult time perhaps sometimes finding the right fit like the right doctor for them, but also thinking that marriage and children and work and commute is the cause of them feeling fatigued and tired and overworked, um, and finding a way to blame the family, to blame their job, their career, rather than starting to heal from the inside out
Hmm.
and taking that step
Yeah.
and working on themselves first.
Hmm.
And that starts with that inside before you can see that
Yeah.
outside change.
Yeah. Yeah. I think that, retrospectively, now that I have this hindsight, I think that at some point before starting TRT, I, you know, I had this idea that okay, it's work, right? It's night shifts,
Right.
the stress, and I don't think I ever got to that point where I was blaming family life, but I tended to think that it's just like family life, having two kids, and a very very active wife, like
Yeah, but you also say, okay, I'm waiting, the baby's not sleeping through the night.
yeah,
I'm commuting, I'm working night shifts, or
yeah,
I'm working 12-hour shifts, or whatever it may be for them. I think just not blaming, but making just sort of what's the word I'm looking for? Um, justifying the way
Yeah.
they feel, how
Yeah.
tired they feel because of the lifestyle that they have.
Yeah.
And listen, yes, getting up in the night when the baby's not sleeping through the night, when babies are sick, when you have two kids or more, of course you're gonna feel tired. So
Yeah.
it's not like you're never gonna feel tired, but
No,
it's
I
not
think that's
just
normal.
feeling tired, right? It's like the lack of sex drive and energy and desire to want to have fun and do things and getting out there. So it's just a factor of positive things that come with TRT.
Yeah. So once I was on treatment and my energy level stabilized, what was the first change that you would say you noticed?
Your desire to want to go work out 6 days a week.
Right. I mean, I think I was still trying to work out a
No, you
lot.
were not working 6 days a week,
No.
and you were not waking up at 4:45 in the morning.
I mean, I think that was later after, because back then I was working nights, so I wasn't, working. I mean, waking up in the mornings, I couldn't do that. But
I mean,
okay,
I noticed. Okay, so I noticed you didn't seem like sad or depressed, or your facial expressions, your demeanor changed.
okay,
Yeah.
got it. And as a woman who, well, who who've been through this, changes and on your husband, um, what would you say to women out there? Let's say that I'm one of your girlfriends, and I'm telling you this story about my spouse, my husband being like, "Hey Maya, like, you know, I don't know, Robert is so tired. He just feels off. There's something different about him." What would you recommend this?
TRT. I'll give them your number.
Yeah, I mean, I think that's a very smart move. I would definitely try to help them. Um, but all right, so I mean, I guess um, a lot of times. I mean, at least I think that my journey was also easier because you were also very supportive, right? So when I told you, that I was on TRT, I was starting this, I sort of like, even though you didn't know much about the subject, I think that you supported me through that. So I think, and this is I'm telling because this is what I'm saying because I usually deal with the patient. I never deal with the partner, but I think the partner is a very important and powerful component of the treatment,
Hmm.
right? So I think that women should be also educated in terms of, hey, my partner is going through these changes in life that they're different or more unexpected than what's going on. Um, and I think it's important for the female partner to also weigh in into that treatment part and say like, hey, Robert, I think that maybe you should get tested, right? Maybe you should look into this whole TRT thing, which now we have a lot more information on. So yeah, that's sort of like what I think,
Or even doing it together.
or even doing
Because
it
women feel
together.
tired all the time.
Women
We
feel
feel
tired all the
tired.
time. Yes,
Yeah.
yeah. And I don't want to go into this subject right now. I think we're gonna do like a different video in the near future. But you're also on TRT, right? Did you feel a major shift in your energy levels after starting
For
it?
sure. Yeah.